Hello and welcome to MedEvidence Articles, where we encourage community research and education with weekly articles. I'm your host, Benton Loeyball, and this week we're talking about a viral liver disease. From cross-contamination to cure, hepatitis C. Medical progress in America has been astounding in the past few generations. A notable example of medical progress is the drop in cross-contaminations between patients. Many people were unnecessarily infected with blood-borne diseases in their attempts to get medical treatment from the 50s to the 70s due to the reuse of medical needles and poor screening of blood transfusions. The use of disposable needles and advancing in the understanding of sterilization and screening since the 1950s to 70s have all but eliminated the risks of cross-contamination in the United States. But for many, the damage was already done. Blood-borne viruses like hepatitis C had already infected millions. Hepatitis C is an RNA virus that circulates in the blood. It primarily affects the liver, with hepat being from the Greek word for liver, and is one of the most common reasons for liver transplants in the United States. Many studies estimate that around 3 million Americans are infected, but many people are unaware of their infection, and studies do not always include people in places like prisons and mental institutions, which have very high rates. According to Dr. Nikhil Kapila on the MedEvidence podcast, the United States
basically now recommends that all adults over the age of 18 get tested at least once for hepatitis C. So your primary care doctor should be approaching you about getting tested for hepatitis C.
3 in 4 people with hepatitis C were born between 1945 and 1965, exemplifying the high rates of cross-contamination in community inoculation programs before the modern era. Thanks to improvements in sanitation and screening, the risk of hepatitis C transmission through medical procedures has significantly declined. Currently, the highest risk of contracting hepatitis C is from illicit injected drugs, with some studies showing over 45% of adult injected drug users may have hepatitis C. Higher rates are found in males, African Americans, and Hispanic Americans. Viruses like hepatitis C cause damage by reproducing. They infect a host cell and hijack the cell's own machinery to produce so many virus particles that the cells burst and die. With hepatitis C, the primary cells infected are located in the liver, which is responsible for functions such as regulating and filtering blood, processing nutrients, and producing digestive fluids. The liver is particularly good at regenerating, however, and many patients remain symptom-free for years. Long-term hepatitis C infections are called chronic hepatitis C, and over time the chance of liver damage increases. Chronic hepatitis C can cause liver damage in the form of fibrosis and/or cirrhosis and is a leading cause of liver cancer. Symptoms of hepatitis C include dark urine, fatigue, jaundice, flu-like symptoms, abdominal pain, and weight loss. Treatments for hepatitis C have taken a path quite the opposite of popular music, in my unbiased opinion, and have gotten better and better through the generations. There are no vaccines that can prevent hepatitis C, but medications to treat the infection have come a long way. From the 1990s to the 2010s, our best treatment was interferon, a type of signaling molecule produced by the body to fight viruses. Interferon worked for some patients, but had a long treatment time, heavy side effects, and a limited response, especially in Black Americans. According to Dr. Kapila,
but over the past 5 or 10 years, there's been a tremendous amount of research in the hepatitis C world. And you have very effective antiviral agents that cure hepatitis C with an almost 99% cure rate, which is just remarkable.
These medications, which disrupt the ability for viruses to create the proteins they need, are called direct-acting antiviral agents. Direct-acting antiviral agents tend to have fewer side effects and shorter treatment periods, which helps keep people adhering to the medications. There is still a need for new medications, however, as there continue to be drug-to-drug interactions and some issues when patients already have liver damage or other diseases like HIV. Clinical trials are ongoing to find new treatments for hepatitis C and leave this disease solidly in the past. Thanks for joining us on this week's episode of MedEvidence Articles. If you'd like to know more, all of our descriptions are linked in the podcast description below. You can also visit our website at medevidence.com. MedEvidence helps answer the question of who can you trust for medical information. The MedEvidence platform provides valuable information about many medical issues and the insights of evidence-based medicine. MedEvidence educates audiences through engaging and entertaining magazines, podcasts, videos, articles, and presentations. We strive to bring together diverse voices of top-level medical professionals, researchers, and experts to provide unique and engaging content that uncovers the truth behind the data. For more great content, including discussions by physicians and subject matter experts, check out the Med Evidence podcast. My name is Benton, and we'll see you next week.